Acid reflux is a common digestive problem. It happens when stomach acid flows back up into the esophagus. This backward flow is also called reflux. Acid reflux can cause a burning sensation in the chest. This is known as heartburn. Heartburn is the most common symptom of acid reflux. Other symptoms can include regurgitation, which is a sour or bitter taste in the mouth. Some people experience a feeling of food coming back up into their throat. Chronic cough and hoarseness can also be symptoms of acid reflux. Acid reflux is a common condition. It affects millions of people. While occasional acid reflux is normal, frequent or severe acid reflux can indicate a more serious problem. There are two main types of acid reflux: occasional acid reflux and chronic acid reflux, also known as GERD. Occasional acid reflux is very common. It happens to most people from time to time. It is usually not a cause for concern. GERD stands for gastroesophageal reflux disease. It is a more serious form of acid reflux. GERD occurs when acid reflux happens frequently and causes bothersome symptoms or complications. GERD can lead to serious health problems if left untreated. These can include esophagitis, esophageal stricture, and Barrett's esophagus. These conditions can increase the risk of esophageal cancer. Acid reflux is caused by a problem with the lower esophageal sphincter, or LES. The LES is a ring of muscle at the bottom of the esophagus. It acts as a valve between the esophagus and the stomach. When working properly, the LES relaxes to allow food and liquid to pass into the stomach. It then tightens to prevent stomach acid from backing up into the esophagus. In acid reflux, the LES weakens or relaxes inappropriately. This allows stomach acid to escape into the esophagus. Several factors can contribute to a malfunctioning LES. A hiatal hernia, where part of the stomach protrudes through the diaphragm, can disrupt the LES's function. Certain foods and habits like large meals, fatty or spicy foods, smoking and lying down after eating, can also trigger acid reflux. Section 4. Risk factors for acid reflux. Several risk factors can increase your chances of developing acid reflux. Some of these risk factors are related to lifestyle choices, while others are medical conditions. Lifestyle factors that can contribute to acid reflux include obesity, smoking, and eating a diet high in fatty and spicy foods. Consuming large meals and eating close to bedtime can also increase the risk. Medical conditions that can increase the risk of acid reflux include hiatal hernia, pregnancy, and certain connective tissue disorders, such as scleroderma. Some medications, like certain painkillers and antidepressants, can also relax the LES and worsen acid reflux. Section 5. Diagnosing acid reflux. Diagnosing acid reflux often begins with a thorough review of your symptoms and medical history. This initial step is crucial in understanding the nature of your condition. Your doctor will ask detailed questions about your symptoms, how often you experience them, and any specific factors that seem to trigger or worsen them. This helps in creating a clear picture of your health. In many cases, the diagnosis can be made based on symptoms alone, especially if they are classic signs of acid reflux. However, further testing may be needed to confirm the diagnosis or rule out other conditions that might mimic acid reflux symptoms. Two common tests for diagnosing acid reflux are a barium swallow and an endoscopy. These tests provide more detailed information about the esophagus and stomach. A barium swallow involves drinking a barium solution, which coats the lining of your esophagus and stomach, and then taking X-rays to visualize these organs. This test helps visualize the shape and function of these organs, allowing doctors to see any abnormalities or issues. An endoscopy involves inserting a thin flexible tube with a camera attached into the esophagus and stomach. This procedure is more invasive but provides a direct view. This allows the doctor to directly visualize the lining of these organs and check for any abnormalities, such as inflammation, ulcers, or other issues that might be causing your symptoms. Section 6. Prevention and management of acid reflux. Preventing and managing acid reflux typically involves a combination of lifestyle changes, medications, and in some cases, surgery. It's important to understand that each person's situation is unique, and a tailored approach is often necessary. Lifestyle changes are the first line of defense against acid reflux. Regular physical activity, such as jogging or yoga, can significantly help in managing symptoms. These changes aim to reduce pressure on the LES and minimize acid production. Keeping a food diary can help identify and avoid trigger foods that exacerbate symptoms. Some effective lifestyle modifications include eating smaller, more frequent meals, avoiding trigger foods, maintaining a healthy weight, quitting smoking, and reducing alcohol consumption. Additionally, avoiding lying down immediately after eating and elevating the head of your bed can also be beneficial. Medications can help neutralize stomach acid, reduce acid production, or strengthen the LES. Consulting with a healthcare provider can help determine the most appropriate medication. Antacids provide quick relief by neutralizing stomach acid. They are often used for immediate symptom relief. H2 blockers and proton pump inhibitors, or PPIs, reduce the amount of acid produced in the stomach. These medications are typically used for longer-term management. Prokinetics help strengthen the LES and speed up stomach emptying, which can be particularly useful for those with delayed gastric emptying. In severe cases of acid reflux that don't respond to lifestyle changes and medications, surgery may be an option. Consulting with a specialist can help determine if this is the right course of action. Surgical procedures like Nissen fundoplication aim to strengthen the LES and prevent acid reflux. Recovery from surgery can vary, but many patients experience significant relief from symptoms. Section 7. The importance of managing acid reflux. Managing acid reflux is crucial for maintaining good digestive health. It involves understanding the triggers and making lifestyle changes to prevent symptoms. Untreated acid reflux can lead to a range of complications, some of which can be serious. These complications can significantly impact your quality of life. Chronic inflammation of the esophagus, known as esophagitis, can cause pain, difficulty swallowing, and bleeding. This condition requires medical attention to prevent further damage. Over time, repeated damage to the esophagus can lead to esophageal stricture, a narrowing of the esophagus that makes it difficult to swallow. This can severely affect your ability to eat and drink. Barrett's esophagus is a precancerous condition that can develop in people with chronic acid reflux. It is important to monitor and manage this condition to reduce cancer risk. In Barrett's esophagus, the cells lining the esophagus change to resemble the cells lining the intestines. This cellular transformation is a warning sign. This change increases the risk of developing esophageal cancer. Early detection and treatment are key to preventing this progression. By understanding the causes, symptoms, and treatment options for acid reflux, you can take steps to manage this condition and protect your digestive health. Effective management can lead to a better quality of life and prevent serious complications.